Considered one of the most severe conditions after cancer, Alzheimer's disease is both feared and mysterious. Your loved ones may no longer remember who you are. Once diagnosed, it is difficult to reverse the progression. According to the World Health Organization, approximately 50 million people worldwide currently suffer from dementia, a number projected to triple, reaching nearly 78 million by 2030 and 152 million by 2050. As cases rise, Alzheimer's disease increasingly affects younger people. Dementia is now a condition that impacts everyone. This is why adopting preventive habits in daily life is essential, along with being attentive to early warning signs. Among the early symptoms of dementia are memory loss, language difficulties, and changes in behavior. But did you know there are also visible signs now associated with brain dysfunction? Let's explore 4 visible signs that may signal an increased risk of developing dementia. The first indicator is called the ear crease, also known as Frank's or Lichtenstein's sign. It is a diagonal crease on the earlobe, easily noticeable and considered a possible sign of cardiovascular or neurovascular conditions. A recent study conducted at Kaeyoung-hee Hospital in South Korea showed that individuals with creases on the earlobe had about twice the risk of developing dementia compared to those without them. Additionally, another study published in an American Journal of Internal Medicine found this crease present in nearly 80% of 241 patients hospitalized for an acute stroke. Experts explain that this crease may be linked to the condition of the elastic fibers and micro blood vessels in this area. A deep crease on the earlobe indicates poor blood circulation, often associated with cardiovascular and neurovascular diseases. Although temporary creases may form during sleep due to the pillow, the diagonal crease here is much more pronounced, deep, and persistent. Monitoring the earlobe regularly for this sign is thus important. The second visible sign involves yellow spots on the eyes. Researchers from the University of Belfast found that eye exams can identify indicators of Alzheimer's disease. They observed that people with this condition often have more small yellow spots on the eyes, known as drusen. These deposits of fat, protein, and minerals, including calcium and phosphate, form beneath the retina. Although common with aging and generally harmless in small quantities, an increase in size and number of these spots can contribute to retinal degeneration. Another study conducted at Queen's University in Canada revealed that among 117 Alzheimer's patients, 25% had drusen, and these spots had grown in size and number after 2 years. Moreover, researchers noted that blood vessels in affected individuals appeared different. They were wider near the optic nerve and thinner at the periphery of the retina. These changes can reduce blood flow to the brain, promoting the development of Alzheimer's disease. Eye imaging could become a simple, affordable tool to monitor eye changes and assess brain health. The third symptom concerns sleep disturbances, particularly sleepwalking and sleep duration. Sleepwalking associated with dementia differs from classic sleepwalking. Typically, sleepwalking occurs within the first 3 hours of sleep and involves talking and moderate activity. In contrast, sleepwalking associated with dementia primarily appears in older individuals, late at night, and manifests as shouting or abrupt arm movements. During REM sleep, the cerebellum normally controls movements, allowing muscles to remain still during dreams. However, in brain disorders like Parkinson's or Alzheimer's, nerve cells responsible for dopamine secretion in the cerebellum may be damaged, leading to movement regulation problems and agitated behaviors during sleep. Additionally, French studies from the Institute of Neurosciences in Montpellier have shown that extended sleep duration of at least 9 hours is linked to an increased risk of dementia. These sleep changes can be observed up to 12 years before diagnosis. It is recommended to aim for about 7 hours of sleep per night to maintain good cognitive performance. After age 40, significant sleep changes like extended duration or difficulty falling asleep should be discussed with a healthcare professional. The fourth sign is the reduction of the sense of smell. A study conducted by researchers from the University of Pennsylvania School of Medicine in the United States involving 728 elderly individuals showed that olfactory functions begin to decline as early as the first stages of mild dementia and continue to deteriorate with disease progression. Another study from the University of California, San Francisco, involving 1,794 people over 70 over a period of up to 10 years, found that each 10% reduction in olfactory function increased the risk of dementia by 19%. Experts explained that beta amyloid protein, associated with Alzheimer's, affects not only the central nervous system but also essential olfactory cells. Olfactory nerves convert inhaled odor particles into electrical signals. When these nerves are damaged by disorders like Alzheimer's, the sense of smell is impaired, and odor perception diminishes. Difficulty perceiving odors may therefore be an early sign of the disease. We now know that our body undergoes significant metabolic changes long before the first symptoms of Alzheimer's appear. Identifying these early signs enables earlier diagnosis and increases the chances of effective treatment. Moreover, ear and eye exams are far less invasive than brain exams. However, it is essential to remember that a single symptom is insufficient for a diagnosis. Conditions are complex, and every individual is unique. If you have doubts or questions, consult a healthcare professional. Being attentive to your body is vital, as self-awareness is key to a balanced and fulfilling life. Together, let's age better. If this video was helpful, feel free to like it and subscribe to discover more tips on managing your health.